We are very excited to have a sunny day here in Boston, Massachusetts. I don't know where you are in the world, but we are very glad for sunshine any day that we can get it here. And it's going to be really warm and summery the next 3 days here in the 80s. So yay, we're really excited about, oh, sunny in New York too. Thank you, Nancy Wexler. Yeah, we got a lot of New Yorkers on this call. If people would like to, please feel free to chat in your name and where you're from, the organization you work with. We just love all that peer sharing about who we are. So, and we've got a whole crew of people, of speakers today who will introduce themselves. All right, well, I have 301. Are we good to go, Sumeri? Yes, okay. Well, welcome everyone. As I said, this is, my name is Alice Bonner and I chair the Moving Forward Nursing Home Quality Coalition. Some of you are people who've been on these calls every month and we're so glad to see you. Some of you may not have been on these calls before, so we will say very briefly that the Moving Forward Coalition is a group of organizations that has come together in response to the National Academies of Sciences, Engineering, and Medicine 2022 report that was called the National Imperative to Improve Nursing Home Quality. So everything that we do as a coalition is focused on improving the quality of life for people who live and work in nursing homes in the United States. So we've been at work for almost 2 years now, and we're very proud of all our accomplishments. We're working on kind of our wrap-up report to our funder, the John A. Hartford Foundation, and very glad that Nancy Wexler from John A. Hartford is with us today. Nancy, do you have anything you'd like to say on behalf of the John A. Hartford Foundation and kicking off this call?
Well, thank you, Alice. Yes, I'm Nancy, Program Officer with the John A. Hartford Foundation, and my colleague Jane Carmody, I'm pretty sure will be joining, but I just wanted to say thank you.
I'm on the phone.
Oh,
I'm on the phone at the airport, but Nancy, please proceed. And so excited for this call today. And I think Cheryl Phillips is joining as well, if she hasn't yet. And we're so excited, Alice, to be here today. And Nancy, please go ahead.
That's it. That's all I wanted to say. I'm really looking forward to hearing from these young leaders today. Thanks so much, Alice.
Oh, you're so welcome. And Jane, thank you so much for saying that you are on the call. We're thrilled to have you and Nancy, and if Cheryl joins, that'll be great as well. So we have a tremendous group on this call. We have people who are nursing home residents, and we're gonna ask them to speak today. We have people who are advocates. We have people who are leading work in the great state of Michigan on a Moving Forward Michigan initiative. We have people who are family members and care partners. We have geriatricians, we have nurses, we have many, many other organizations that are committed to the same mission, vision, and values that we have in terms of, there is so much that we can do right now to improve quality in nursing homes. But the topic for today is actually something that has come up in conversations that we've been having. Sumeri, by the way, I'm joined by Sumeri Maki, who is our associate director and co-leads a lot of the work with our director, Isaac Longobardi, who's on a different call right now, but sends his regards. In our conversations with our steering committee members and our work group co-chairs and members, one of the things that comes up a lot is this notion that sometimes it feels like a lot of the people who are in aging programs and services are people my age or older. So I'm 67. I've been doing this for 40 years. I know that I've been around a long time, and we want to ask ourselves, and one of the reasons for doing this today on the call, how can we get more young people or people who are, let me say, more junior in their career? I don't mean young in age necessarily, but people who are just, getting started with their career and finishing up their education. How can we talk to those individuals and find people who might really get interested or be interested in aging programs and services? So we have a wonderful group of speakers today and a set of questions that I'm going to ask them, and Sumeri is going to jump in as well. And we're going to ask them some questions to give us background to have a discussion in the second part of this call with all of you. So This isn't a call where we're just presenting information. This is a call where we're really engaging and generating momentum around this discussion, because we think this is a huge opportunity. This is an opportunity to say, why aren't there more people going into this field? What's the reason behind that? And how can we think about that together and come up with some actual solutions? If you know anything about the Moving Forward Coalition, you know that we are about action, action, action. We're not about doing huge, long research studies. We think those are great. We support that. But that's not who we are. We are about what can we start doing now. So I'm going to start with Sophia Casale, and I'm going to ask each of the speakers to introduce themselves and tell you who they are. And then I'm going to ask Sophia the first question that we have today, which is, you know, Sophia, how did you find your way into aging or long-term care? What drew you to the field of aging? And first introduce yourself, and then if you could answer that question, that would be wonderful. Go for it.
Absolutely. So thank you first and foremost to you, Alice, Samir, and Isaac. I know he's not on the call today, but for bringing me on this webinar today. I've always enjoyed keeping up to date with what the Moving Forward Coalition is doing, so it really is an honor to be here today. So my name is Sophia Casale, like Alice had said. I live in New Jersey. I work in the assisted living sector of long-term care, and I work with those who have Alzheimer's disease and related dementia. I'm in the activity department of my assisted living. I am also a volunteer project coordinator for Grey Panthers NYC. So I deal mostly with our volunteers and our interns and trying to give them the best opportunities that I will speak about in a little bit, about some of the opportunities, how I found them later on in my journey. But and I am also I sit on the NGO Committee on Aging in Geneva, which is very closely related to the UN. So I do some work with them as well. My journey to the aging field has been a bit twists and turns, and from what I hear from others, it has been very similar for them as well. So I started out my bachelor's degree, and I thought I wanted to be a speech pathologist, and I thought I wanted to work with children, actually. And a year and a half into that, I realized I do not like speech pathology, but I did an internship, or I really shouldn't say an internship. I considered it an internship, but it was mostly volunteer work in a level 2 trauma center here in New Jersey. And I was placed on the pediatric emergency side, but connected to that was the care center. And that's where a lot of older patients coming to the ER would go. And I kind of always found myself on the care center side. And shortly after that, I took a class in clinical neuropsychology, and I realized Alzheimer's disease and dementia and other neurodegenerative disorders were kind of my niche, what I might like to explore a little further. So I worked in a skilled nursing facility for a little bit after graduation with my bachelor's, and then that kind of setting wasn't for me, but the assisted living setting was, and the opportunity I was provided gave me some more opportunities, or the ability to work with those who have all sorts of dementia and neurodegenerative disorders. So I kind of jumped into that. I went in for my master's in gerontology at UMass Boston. And through that experience, I kind of began to connect with some of my fellow professors and colleagues and students. And I was given the opportunity to work with the NGO Committee on Aging in Geneva and get to know a little bit more about the, but they say older persons, not necessarily older adults, but older persons and how they're represented in the United Nations sphere. And I was connected with Grey Panthers through that, through my professor who chaired the committee in Geneva. And through Grey Panthers, I began to get connections like with Alice, and got to learn a tremendous amount of skills as a project coordinator. So it all kind of, one thing led to another, but and now I will be going for my PhD in gerontology at UMass Boston. So continuing that research area. So
Wonderful. That is a great story. And I'm so curious if other people have similar sort of twists and turns. I know I'm just here because of, again, I was running out of money in college, as I've often said, spending money. And my faculty advisor said, well, they always need people over at the nursing home to be a nursing assistant, and you didn't have to be certified back in the 1970s. So I got a job, and here I am 40 years later. So anyway, everybody who's interested, feel free to chat in your stories. Sophia, that was a great introduction. Thank you so much. And maybe we'll move on to Kate. So Kate is going to introduce herself. And Kate, what would you say about, have you ever considered leaving the field? I know you've worked in the field for a while. Have you ever considered leaving aging programs and services? And if not, what has kept you here in spite of other, things that might be tempting? So first, introduce yourself.
Yeah, thanks, Alice. And thank you both, Samir and Alice, for the invitation, and all of the other panelists. I've enjoyed knowing a couple of you for a couple of years now, and getting to meet the rest of you over the last few weeks. So my name is Kate Poppenhagen, and I am currently a long-term care ombudsman. So I'm a resident advocate for folks who live in assisted living and skilled nursing. And I live in Windsor, Colorado right now, but I will be leaving to live in Oxford, Ohio, and start my PhD at Miami University in social gerontology. Thank you. So I'm very excited to be here. I'm so glad you asked me this question, Alice, because when I read through them, I was like, yes, that one. So I actually did leave the field. I did. So I liked that we quantified that this was new professionals or emerging professionals, as well as young professionals. So my journey in long-term care actually started in 2008 when I was 21. And I started as a direct care provider for folks with intellectual and developmental disabilities. And I cooked and cleaned, and I always tell people I actually learned how to care for myself through caring for others. So I learned how to make meals and take care of my own laundry from taking care of other people. And eventually I went into vocational services, and I ended up in a sheltered workshop, which was just fraught with dehumanizing and institutional practices. It was a horrible, horrible place to work. And one day I got hit by someone. I was doing things in the name of behavioral services, and I got hit, and I took a step back and realized I had strayed very far from where I had started as a direct service provider. I was no longer caring for people. And so I went to art school, and I drove for Uber, and I worked in a bar. And I did not talk about long-term care for about 3 years. Wow. And I made it to grad school after art school, and realized I really missed it. And I think long-term care is a calling.
Yeah.
And I think it's a calling that people are drawn to, and that they answer, and that those who love it are just in it for life. And so when I was in grad school, I read critical theory, and I read critical race theory and feminist theory and critical disability theory. And all of a sudden I started to get language to describe the things that I was participating in, the ways that I was seeing people, through behavioral services. And I was starting to understand a little bit better about my relationship to people with disabilities. And so that's really the place that I advocate from. It's from a place of understanding the power of being able-bodied in spaces where you are helping and supporting people with disabilities. It's an understanding really of the relationship that we have to people who are in services because they can't live without services outside in their own homes. And so for people who think, oh, I'm getting burned out and I want to leave the field, I had a great experience doing that. I came back refreshed with an incredible perspective that I wouldn't have gotten if I had stayed in. So.
Wow, that is another incredible story. We're going to have a separate call just for you to talk about being an Uber driver, because I'm fascinated by that. But anyway, thank you so much for sharing that journey. And yes, it's great that you came back and brought all those experiences with you. It's about who we are as people and what we've done in our lives and all of that. So fantastic. So Jonas is gonna give us some thoughts next. And Jonas, I'm wondering, what's the one thing that you personally are committed to changing or improving in older person services and long-term care? And what would you, and I've heard you talk about this, so I have a little bit of a spoiler, but you might say something different this time. And what would you tell the other people on this call in terms of finding their own passion for something or getting involved with what you are most passionate and committed to? So first, introduce yourself and tell us who you are, and then answer those questions if you would, please.
Hi. Hi, everyone. I'm Jonas. I've heard Kate tell her story a bunch of times, but every time it gets me. It gets me again. I got into this field as a family member. I was working at a tech hospitality startup in New York City, having graduated from Northwestern with a degree in film and business. And when my grandma ended up with a heart condition, she landed in a skilled nursing facility, and I experienced from her perspective what was prioritized and what was missing from her experience. I always felt like the food did a really good job of kind of encapsulating the rest of her experience. It was beige and kind of devoid of texture, color, or flavor. And here were all these people running around the halls, showing up for residents like medically, and it was so abundantly clear to me that what they needed was color, love, flavor. So I joined this field pretty soon after that, as I started actually at the bedside as a CNA. But with regard to the one thing I'm personally committed to changing or improving, I mean, I think that it's really fascinating, right? We see, Alice, you said you kind of got sucked into this field trying to work your way through school. Kate, you got kind of sucked into this field working in the IDD world. Sophia, you got kind of sucked into this field. There's something that has this like inherently like vacuum-esque effect on people once they step into a community, once they step into the field in general, whether it be as a home health aide or as a volunteer or as a family member. There's a certain like exposure to the rawness of human nature and human life in a country where we so frequently focus on doing. It's a space where there's, as you know, Bill Thomas talks a lot about being, and there's something really like addictive about that, I think, that keeps people coming back and kept me coming back. So when I think about what I'm interested in and personally committed to changing and improving the world of elder services, it's partially it's bringing people in and having people have that first step into perhaps a skilled nursing facility or an assisted living. One of the ways that I'm currently focused on doing that is through plants. There was a really fascinating study a while ago by Ellen Langer and some first name Rodin. I don't remember her first name. And they gave plants to all of the residents in a skilled nursing facility. And for half of the residents, they said, sorry, my girlfriend's texting me. For half of the residents, they said, you are in charge of, this is your plant. This is your plant. You water it, you take care of it. If it dies, it dies. This is your plant. We're going to offer you some community programs on how to take care of it, and how to connect with other people taking care of their plants. For the other half, they said, you're going to keep this plant in your space, but the staff will take care of it. It's going to belong to the community. And the half that took care of their own plant had 93% of those people. I was refreshing myself on the data, thinking I think I might talk about this on this call. And 93% of the people who took care of their own plant either remained at the same level of ADLs or actually improved, whereas around 70% of those who were not taking care of their own plant had a loss in ADLs, which is wild. That is absolutely wild. And so I could have been, I just chose to be really literal with the interpretation. I was like, oh, I'm just going to get as many resident plants as possible and give the workshop on how they will be taking care of their own plants. And the way we've gone about doing this, and I've now done it in 2 consecutive years in 2 consecutive communities, and we're applying for the Eisner grant to try to do this in as many communities as possible, is get other younger people or new people. I like this idea of new people to into the community to bring the plant and to do a plant potting workshop with the residents. And then at the end, you gift the plant to the residents. So to me, it's the combination of getting people in, which I'm really, really passionate about, and proliferating autonomy in the resident experience and giving them something to take care of themselves.
That's great. And I love the way you wove all of those ideas together. And I know Nancy Stevens chatted in about some work that she does with other people who are living in the nursing home. And I know we've got other people. I saw Taylor McMahon nodding her head about as a DON, thinking about this. So those are great ideas. And again, I would say to people on the call, one of the things that sometimes holds organizations back is if something's really huge and expensive. We know that sometimes people just say, well, we don't have the money to do that. We can't let that be the conversation, right? There's so many things we can do. We have to be focused on what can we do? What can we do now? Who can do it? Where can we get volunteers? Where can we get interns? And then also, where can we find more funding so that we can do these things? So Jonas, great comments from you. Thank you so much. And we'll go to Jordan Evans next. And Jordan, we're going to ask you first to introduce yourself, but then to also talk a little bit about, is there a recurring belief or principle that you've identified that you think, maybe holds us back, something that stands in the way of us making more progress in the field of aging programs and services? And what can we do to combat this? So what's the one thing that you think we can do to combat something that's standing in the way? And first, introduce yourself.
Like a 2-part question.
Yes.
I'm Jordan. So I am co-founder of an organization called Art Against Ageism, and work with communities to create art that tackles ageism and promotes positive age beliefs. And what we particularly use is artistic activism, which is art, affect, but effective art that is used to change minds. So your 2-part question. First part, what's the issue, and then how do we solve it? I've recently been doing some internal work as far as to how do we solve it. And so the first part is it's ageism. I mean, the big squeaky wheel in this machine is ageism. And all of our issues kind of boil down to that one squeaky wheel, that's that one link in the chain that's not working. And so whenever we really try to pull on something really hard to carry some real weight, the chain breaks. And it boils down to our staffing problems. It boils down to our leadership. It boils down to the lack of diversity within our industry and the lack of even just focus on our industry on a cultural level. It all boils down, in my mind, to ageism. Now, I do work with ageism, so color me biased. So solving it, and this is the thing that I've kind of just been doing a lot of work on. I met this amazing DEI specialist at a retreat on longevity and inclusion. And they said to me, or they said to the group, they are not a head and heart practitioner. And I've been approaching everything as artistic activism. I often am the head and heart practitioner. Like I focus on going through the heart, getting to the head. And so often in DEI work, a lot of, you think head and heart work, like let's all sit in a circle and tell stories. Let's all really have sessions where we can listen to people and hear their story and do things that change minds through the heart. But we really need systemic practitioners, organizational practitioners. And as an industry, we need people to tell the stories, to buy time. Head and heart is really important to buy time. It's important to have people be heard. But it's so important that someone else in the back is doing the work. Because, and my background as a recruiter, specifically around just the lack of, we were talking about before we got on, a lack of like, I feel like constantly I'm in this industry and I don't have people that look like me and I don't have people that look like me. Like I don't see a lot of people that are the same age as me, and I don't see a lot of people who look like me or even have the same experiences that I do. And we talk about this, and there are some amazing panelists on this that we talk about, and it comes down to us actually. My background is a recruiter, so it comes down to recruiting intentionally. It comes down to putting ourselves in those places, and those are like the organizational things. So the one thing that, to answer your question, what is the one thing we can do? We can do work. Like we can put ourselves as, and I have a hard time identifying this, because if we were like at an oil and gas retreat or conference, we'd be talking about the larger industries and the sub fields within that. But we don't speak like that. But in long-term care, in vendor services, in like, there's a lack of intentionally bringing in younger leadership or younger interns and then giving them opportunities and growth paths. I mean, if you even go to I was talking to an amazing nursing home that is in Baltimore City that I love so much. And I was talking to them about their internship program. And they were like, yeah, we have some awesome interns in life enrichment. And, we have our AIT and we really, try and bring in some. And I was like, oh, so clinical. Clinical or life enrichment, which like life enrichment usually has like director of life enrichment. And then you go to the vendor side of organizations that help with life enrichment. I was like, oh, you don't have any internships in your marketing department? No. Your HR department, like, other things that make up a company, just like every other company in the US. No, we don't provide opportunities for people to find their way in our industry, in our space, in those ways. So, when I graduated with a degree in aging studies, and I will wrap up really quick. When I graduated, I had a hard time finding a job because I didn't want to be an activities assistant, because I didn't want to get paid $15 an hour and for no money. And I didn't see, I was like, oh, do that for 3 years, become a director, and then I'll do that. Well, I don't know what to do beyond that. And I also didn't have a clinical degree. So it's like, what do I do? And I had colleagues of mine who had way better grades than I did that just left and now work in totally different industries and just totally forgot about their aging studies degree or their aging services management degrees. And so that's my solution. We got to get to doing the work and building the programs, and enough of the talk.
Yeah, enough of the talk. That's our refrain always. So yes, thank you for saying that so beautifully. Thank you, Jordan, that was great. Before we move on to Shaniece and Alex, I just wanted to give Carrie Leljadal a moment to talk about why we are so fortunate to have all these wonderful speakers today, because Carrie is the one who actually brought them together and brought them to us. So Carrie, we'll turn it over to you. Do you want to talk about your thoughts on this?
Yeah, so I got real lucky and I met Jonas and Kate last summer at a conference. And then over the course of the next 6 or 8 months, I've met all of these amazing young adults. And it blew my mind watching them and talking to them of their passion and their compassion for what they're doing. But Kate's in Colorado and Jonas was in New York going to school, and they were so spread out. Most of them had never met anybody in the field, like themselves. And I'm like, hold on, something has to change. So I decided just to get them together to meet with no plans whatsoever what would happen after that one Zoom call, and which is what I told them. And watching them connect that afternoon was amazing. We need to bring more young adults into this conversation to do this. They're going to kick ass and they are going to fix this system. We're tired. Let's face it. We need the energy, first of all. And they're not afraid to speak up. They're not afraid to do things. The first time I met Alex, we were at another conference in Baltimore, and I could see him, watching him, and just the love that he had for the people he was taking care of that day that were there with him, the residents that are his family, his friends. And that's what this is about. And we need to bring that into this conversation, into this world, every day, every way we can possibly do this.
Thank you so much, Carrie. No one says it better than you. Thank you so much. And we'll turn back to you for some other comments later on. But I do want to give our last 2 speakers an opportunity to share their stories. And so Shaniece, we're so glad that you're here. And what is the one thing that you think we don't hear discussed often enough when we talk about older person programs and services? What's the one thing we don't talk about, and how could we improve that? And first, start by introducing yourself, please.
Hi, good afternoon, everyone. My name is Shaniece. I'm actually located here in Rochester, New York, Western New York area. And I'm currently a CNA, but I'm actively obtaining my licensing in nursing home administration to become an administrator. Later on, following Kate and also Sophie, to obtain my doctorates as well. I do plan on doing it on the business side because I realize there is a lot of, when speaking to a lot of other administrators and leaders, that true understanding of business and how it works. So within the system, but not only business, but obviously the language when it comes to integrating a lot of things when it comes to long-term care and healthcare. So one thing that I would honestly say, there is so many, honestly, that I see that may not be discussed as much in elder services. I'm just going to say it, 2 things for me. What will it look like in the next 15 to 20 years? That's when I went to my first convocation for ACHCA. I started to propose this question to a few people, and they never thought about it. And it concerned me a little bit because, we're in the now, and working with people like Kate and, Jonas and Jordan and the rest of us that really want to look futuristically of what can we do to develop services and help the next aging generation to come in, whether it be our moms and dads or uncles and aunts or whomever it is, what services can we within the industry use to, create, and how would that look for the next generation? We want to ensure stability. We want to ensure quality. We want to ensure these things that continue the longevity for the people we serve and for the homes, whether it's, home care, whether it's hospice, whether it's, as I was sharing with others, long-term care can look different in many settings, and that even includes even in the jail. that sort of thing. What will it look like in the next 15 to 20 years? And also, my second point would have been mental health. That piece. I gained so much more deeper compassion over the years when it comes to having the conversations with residents and families, when it comes to the mental health piece and understanding that really everyone goes through grievance differently. And sometimes, taking those traumatic events people have gone through in life, it really, shapes us differently, all individually as, different people. And really having services that talk about the mental health aspect on a deeper level to help us really cope, and prepare our frontline workers, prepare those that are in management, prepare those that are outside in the field working, not only residents but us as individuals go through mental health. And it's tough. A lot of us are stressed, we become frustrated, irritated, and some people react differently when it comes to being overstimulated in these settings. So, best way in practicing mental health, and learning to talk with each other, or services and meditation, or whatever it is that we can really gather as one, really foster a healthy system overall in the next several years. So the things I would definitely say, for starters, I would want to hear discuss a lot more.
Great. Thank you so much, Shaniece. That's a very good and comprehensive view of much of that. And thank you. We'll be glad to circle back. And we have one final speaker, and then we're going to come back to this conversation and ask everybody to engage around, okay, having heard all of what you've heard today, what can we do? How can we really answer the question I posed at the very beginning about getting more people who are fairly junior in their careers into and retaining people in aging programs and services. So Alex Eshelman, Alex is going to introduce himself and talk about his career, but also, Alex, the question that we have for you is, again, what I just really teed up is that there aren't enough younger people young in their careers, who are going into aging programs and services. And so from your conversations and your experiences, both with your peers and the work that you do, what can everybody on this call do to encourage people to go into these programs, and specifically into work in nursing homes that I know you're very involved with? So introduce yourself, please, and then if you could give us your thoughts on that.
Thank you, Alice. Yeah, hey everyone, my name is Alex Eshelman. I am the Associate Director of Open Doors. Pardon. It's a small nonprofit based out of this nursing home on Roosevelt Island. I work with a group of residents called the Reality Poets. They all do art and poetry, and we basically use our art and creativity to spread our message, tell our story, social advocacy, events, community building, etc. I'm sure you can imagine. Yeah, and it's been really great working with the group. I've been with this team for 4 years now, or it will be 4 years this summer. I started in summer 2020. So, and yeah, I mean, I'm just gonna finish my intro real quick before I answer your question. I'm trying to think if there's anything. I mean, like, I feel like kind of like some of the other questions get you here. Like, it's like weird, like, I was almost apprehensive to be in this space at first because I feel like I work in like aging care in a way, but like I also feel like I don't know, I was almost like shocked to be included in the group at first because like I don't know, I feel like there's not just like one career or one job that like young people in aging have. I feel like it's been great to be in community with people like Moving Forward Coalition, Gray Panthers, lots of other community, and like those are just the names that come to your mind, but it's like so many random people you meet along the way, right? And everyone's doing sort of different things, um, which I think then makes it kind of hard to know what that career looks like, or like if you're in it, or if you're just like on the sidelines or something like that. And like I don't want to just like speak forever about like the work we're doing. You know, like, I could tell you more about like, you know, like I said, we do these different sorts of art projects, right? And it's like anyone here who runs a nonprofit or does any sort of entrepreneurship or social entrepreneurship or like I think any development work, right? Like I view my bottom line as like fundraising and program planning, you know, like it's just like the ins and outs. So, which is like ironic because in a way, long-term care is a lot like that, you know, it's just like a part of the life cycle. So like I think I've been blessed to learn many valuable lessons, develop skills here. So I'm kind of gonna transition to the question, you know. Because yeah, there's like so like I think the first thing and the most obvious thing is just jobs, right? It's like, are there jobs young people can do to like provide for themselves and their families? You know, like that's like real. I think like you know, we could talk about like staff wages or even like for people like working directly in facilities or even people like myself who, you know, sort of again work like in these tangential like community support roles. Like it's so funny, like I find myself at the nursing home a lot. Sometimes people are like, oh, do you work here? I'm like, not really, you know. Like I tell like I'm a visitor, I'm visiting Vince, you know. But like so I mean, I think that like, and that's what I'm saying. So then again, right, kind of back to where I was saying before, I really ended up here not by mistake, you know, like it was a good happening, but like I got here because I was interested in, you know, the art and the creative side. I'm a musician. So I was just like looking for a creative opportunity, and this was the one that I had access to, you know, it was just an internship at the time, you know. Um, and then so yeah, I mean, I kind of just want to like really emphasize that though. I think that young people need to know that there are jobs, not only that there are jobs, but that their career can continue from working in elder care. Like it's so funny, before ever doing this, a roommate that I had in college, you know, he wanted to get into like I think he wanted to get into like real estate for aging populations or something like that, you know. But again, it's sort of different, like outside the box angle, you know. And again, sort of has since moved on from the idea. I just think a whole lot of people don't even know that there's like a world to like have a career over here, you know. Um, so yeah, there's that. And then sort of in the same vein of that, you know, I think that we gotta let young people, I say not again, not really just young people, but people like say in junior positions or maybe like, you know, transitioning careers, you know, it's like you can develop skills here that you'll be able to take elsewhere, you know. I think that maybe people will have a preconceived notion of what working in elder care can mean for them or for their career, you know. It's like, oh, am I going to get stuck? Is it going to be a rut? Is that like a dead end? But I think to really emphasize the skills building and like the diversity of what you'll be asked to do, you know, because I've learned a lot of things that would be valuable in other places. So I definitely, when I'm talking to students and interns who we are blessed to have, you know, like I get to engage with undergraduate college students who at this point are close to my age, but pretty soon won't be, you know. But like, you know, I try to tell those people like, I just try to like, honestly, when we have like interns, as much like as creating busy work for you, I prefer for there just to be a lot of shadowing opportunities, you know. So I think we should show people what it's like and like what they'll learn and what they'll be doing. And again, we all do different stuff, so that looks different for all of us. The other thing I want to say, though, in that same vein, I think the way to get young people into the field, we can't just talk about the negative because that's bad advertising. And this is like so real. That's what you were saying, Alice, where you're like, oh, you can't only talk about what we can't do. You got to talk about what you can do because then you're just like looking away from your potential, you know? Like, yeah, like you got to tell people the good parts. Like, oh, it's great to be in community, you know? Like, you know, just my personality type, I have always sort of resonated with people older than me more than my peers, you know. So like I like to be around people who are older than me. I feel we have better conversation, you know. um but nah, I just want to put that out. Like I think we really got to emphasize the positives because like that's like when I'm like racking my head to like, how am I gonna answer this question? They just like think all this negative stuff. You're like, you know, like no, like because then no one's gonna want to join, and you can't hold that against people if you only tell people bad part. You can't. You seriously can't. You can't only say bad things and then wonder why no one wants to do it. Like that's just doesn't make any sense, you know. So And like, you know, so then even before moving on, right? Like, what are the good things about working in, like, I guess you could say aging, but it's so funny because in a way everyone works in aging. That's the whole thing where it's like, oh, what's a misconception? Well, not everyone's old, of course, or what's it mean to be old, or what's wrong with being old, or all these, right? Like, it's like aging, like you're aging when you're getting your coffee in the morning. Like, you're always aging, not to get too meta, but you see, so it's like, I don't know, like, I think to let people know that there's an in from wherever they want to get to. That's the crazy part, right? Like, again, I sort of got in here because I was interested in the art component, and then it ends up, and now again, I signed up to work at like a nonprofit with a group of nursing home residents, so yeah, maybe there's not that much surprise there, but I think that for like others and outside organizations, even to know that they could have it in to like, because that's the thing too, like when it comes to like looking for funding or whatever, I'm really interested in seeing like, or like, okay, for instance, like we have hosted community conversations similar to, not so similar to this one, more so like the low key one, really kind of similar, yeah, you say, and like I think getting random people in that conversation from like outside organizations, it's like, oh, invite such and such from, I'm drawing a blank right now, but you know, it's like it doesn't just have to be the people who are already right next to you. I think that that's how you kind of like spread it. And then yeah, I guess while I'm there, I feel like I do want to emphasize, yes, to people here who like are at like foundations and in grant making and stuff like that, I definitely would suggest like considering like, oh, that young people will need careers to come into this industry, like, yeah, please consider that in your grant making practice, just so that like, you know what I'm saying? Like, keep that money open, because if people can't have jobs that pay them enough to really want to keep the job, one, they will leave the job, and two, they'll never have it in the first place. So like, I like, again, like letting new life into the field's got to be a priority. And then
Right.
I also think to what you said, Kate, like, yeah, taking a break is also so valid. Like, sometimes you got to step away, and come back. Like, I guess it's so funny. Like, I don't even like I can't remember who said before. It's like, oh yeah, you get sucked in to like the long-term care thing. I'm like, did I get sucked in? Like, is that what happened? Because I'm like, I'm like, I didn't really show up here on purpose. But then I'm like, wait a minute, because like, and then you think about like the way it relates to your values, your family ties, and you're like, okay, maybe I did get sucked in, and you're like, that's not so bad, right? But like, so like, if you like show people like the good part of it, and like the way it's like, hey, like this is, one of those things that affects everyone. It affects
Right,
all of
right.
us. You've got someone who you care about. So it's like, then I think if you like start there and then like lower the barrier of entry by not making it sound so bad, and by providing jobs that like don't suck and that pay a decent amount, all those things are totally going to keep young people coming in. I have
Right.
one more thing that I thought was like a legitimate, like substantial thing where it's like, I don't know. I think those are definitely starts, but yeah, no,
Those are good. Those are good ideas for us I want to make sure we have some time for discussion here. So people are chatting in about how energetic you are. I'm glad I'm drinking decaffeinated tea, or I'd be jumping out the window. So thank you for all of you, for all of your energy and all of your ideas. There's a lot of people smiling and nodding and clearly engaged in this conversation. So I want to turn it over to the audience for the rest of the time. We have about 12 minutes for discussion, and feel free to say something you did not hear anybody talk about, an idea. And I really want to focus us back on, okay, what are all the things that we can do now to encourage more people? You just heard Alex talk about, being positive, not negative, showing a great role modeling, showing positive, homes that are really people's homes and things like that. You heard, Jordan talk about combating ageism. You heard Kate talk about taking a step away and coming back. You heard Jonas talk about plants and things. Again, we have at least 3 people who are living in nursing homes now on this call. We have lots of people who are involved in some way as clinicians, researchers, advocates, and others, family members. So what else can we do? What's a really concrete idea that you think we could take forward? Penny Cook said a video to capture all of this, a public service announcement. And Jonas, that might get back to you. You talked about your career in filmmaking and your background. So we work with a couple of different companies. One is called Dash Media. They do a lot of work with nursing home videography and documentaries. So, but what else can there be? Those, yeah. Who wants to
Alice,
jump?
I would love to invite Kim and Kathy and some of the other folks who have talked about some of the training programs that they actually lead.
Yeah, my name's Kimberly, and I'm going to give everyone a fair warning. I have a 2-year-old who's going to run around in the background. But my name's Kimberly. I'm with the University of Colorado in Colorado Springs, and I worked with Jonas. It's been a little over a year where we did this March 2nd event, brought in our long-term care community partners, and basically had this long-term care conversation. Jonas came, shared his awesome story, and from there, that's where this internship kind of developed. So we do through the JAWS grant, that's a whole nother conversation, but we had some funds that we could pay college interns, or really at 16 and up, but we were able to recruit 3 in the summer of last year. Since then, that's grown to, we're going into our 3rd cohort, and we can hire 4. That's the college side. Now you have the high school side where we mirrored some of that training, but we worked with our CTE HOSA program through the state of Colorado, developed the high school program, where that's where we started with 8 last summer, and that we're aiming to hit 150 for this summer. So would love to connect and talk a little bit more about that, but yeah, JAWS is going strong in Colorado Springs. Providing those welcome to long-term care. We started with 1 JAWS program. Now we're at 3, and there's leadership involved. It's really grown. So
Awesome. That's great. Thank you so much. Anybody else who was talking about training programs want to chime in? Something going on in your state? Or the nursing home where you are?
I just wanted to say real quick that this is really, really good information. Thank you all for sharing, because we just had this, I work for the state of Arizona, and we were just talking about how can we get younger people in our program? Yeah, we need you in, it was a lot of talk, but no concrete. So I'm taking a lot of notes here. But one of the things that I do long-term care, I'm a state trainer, is that which was really exciting for me. So I had a law student come in as a volunteer. And so as Alex was saying, make it positive. What we do is in long-term care is really kind of heavy work, but it was an opportunity for him to learn regs, policy, applying law. And that's that. And then also mediation and all those other things. So he saw the value in it, and he stuck through the whole program, 36 hours of training, and went out there and did the exam and went out there. But he saw how it applied to what he was doing. So yeah, making that positive connection for not just what we do, but wherever they're going is a good thing.
Right. Awesome. So glad you're on the call. Thank you. I just want to draw people's attention to Hannah, who put a very nice chat in about taking action and contacting policymakers. And then I saw Nancy Stevens' hand up. And then after Nancy, I wanted to ask Michelle Arnott from Gray Panthers NYC to say a few words. So Nancy, are you still on? I know your hand. Oh, there you are. I see you.
I'm still here. I'm sorry. I think, Jonas, first of all, shout out. Honey bear propagation. Yeah. I don't have a lot of containers, so I use what I have. It's a honey bear. Anyway, so I just had a conversation. I put this in the chat, but a conversation with a young man named Ashwath Nararianan. Yeah, got it right. And another conversation, basically the same conversation with a gentleman named Ernie Dos Santos. And they both want to get in on making videos and passing the information around on social media through their companies. And they work with a lot of celebrities. Julia Louis-Dreyfus is one of them. Susie Singer-Carter and I just had a conversation about comedians like Julia Louis Dreyfus is one of her besties, Seinfeld. And then I'm in touch with Roy Firestone now, who's going to connect me to just gobs and gobs of celebrities. So I think that's a really great way to get communities involved. Also, your local health systems, like your county health systems, are really a great way to interact with like the behavioral health department, for instance. There's a lot of like subcommittees that they need community involvement with. You can be like a cultural community liaison, like I am with mine, but you would interact with like even like PEI, prevention and early intervention, where you're working with younger people and people who are coming of age into the workforce. And then we also have something in the state of California called Caring for Cal. And the program, I think it's only going to last for another 5 months, is about how long, maybe it's 5 weeks. I'll have to double check, but it's called Caring for Cal. And this provides also, it provides free training, free certifications for anyone who wants to become a CNA. And it also provides additional counseling services and mentoring supports. It provides gas cards for people to get to and from their training and to and from work. You can also do the training online on your own time, which makes it so much more convenient, especially for like young moms and things like that. But they also provide gift cards for grocery stores to sort of supplement the low income, and then other wraparound services that they childcare. That's a major one. Yeah.
So Nancy, we only have 4 minutes left. So I want to say thank you for all that information. That's fantastic. Obviously, people should contact Nancy if you are interested in any of those programs, but obviously there's a whole lot going on there with Caring for Cal. Before we turn to wrap up, I just wanted to give Michelle Arnott a chance to talk about an award that the Great Panthers NYC is coming out with. So just in a minute or so,
Right.
Michelle, can you tell
I will
folks
be very
that?
quick. Thank you so much, Alice, for reminding everybody that the Great Panthers NYC will be giving the speakers from today an award on July 30th on our webinar. So it's called the Gerson Award because we have one major donor, Jill Gerson, and we want to honor her, and we want to honor these wonderful young adults on the program today. I also would like to offer that we would like to create a PSA. Maybe each one of the presenters today would like to do 1 minute to explain why gerontology is a worthwhile field. So we'll follow up after this program.
Okay. Fabulous. And as I mentioned, we do work with a number of companies, and we've got people on these calls who also do that. So we have time for one more brief comment. And I know Johanna, you had your hand up, so we'll turn to you if you can tell us briefly what your comment is. Go ahead.
I just want to briefly talk about our strategies, what we use with our masters in aging students. We realize that the gerontology community is very small, and so we have students, it's online, and they're from all over the country. So what we do is we have a field assignment for every class, and that helps them get connected to aging organizations in their community. So when they get out of school, they can, know them and be familiar with them, and hopefully be able to obtain employment after graduation.
Fantastic. That is a great note to end on. You're doing something at the university. You're bringing people into the field. Fantastic. Thank you so much. Jane Carmody, if you're able to, we see you off and on, but Jane's our senior program officer, and I'd like to give you an opportunity to reflect back and close us out here.
Alice, I'm just I'm just in awe. What an exciting call this has been. I was just thinking we've had so many exciting, because being with Alice, you're excited, but this has been tremendous and great people on the call. And Nancy Stevens, how wonderful of you to have such good idea. Everybody, Alice, this has been Thank you so much. Carrie, thank you. Carrie's always coming up with great ideas. So this has been great and look forward to more. This is an action-oriented group, Alice. So
And
thank you for your leadership as well. This has been great.
Thank you so much. And I want to thank Sumire, who keeps us all honest all the time. But I think there's something here. I really do. I always think that after the coalition conversations, but I really feel it in this group. And I think we should see maybe there's a way to keep this group going and just focus on this issue and get some things done. So Sumire and I will put our heads together, and Jane will follow up with you. And
that's good.
Nancy,
Cheryl Phillips was able to attend as well, just to let you know, Alice.
Yeah, Cheryl, do you have any final thoughts, or are you good?
I'm good, but just in awe. This has been fantastic. And again, bottling this energy, and happy to talk more in the future. So thank you.
Well, thank you. We recorded this call. So if you want to have anybody else listen, please do. We'll be posting it soon. And this coalition exists because of you, not because of me or Sumire. It's you guys that are doing this. So we will be in touch. We're really grateful, and you'll hear from us again. And thanks to all of our speakers today. You guys were beyond amazing. Thank you. Thank you. So keep sending us your ideas. Have a great rest of your week, everybody. Thank you so much.
Thank you.